Thanks so much for staying with us. Now, Johnson & Johnson vaccine booster shots will be made available to all healthcare workers who received the first dose as a part of the Sisonke trial, as it were. The backup now being that the J&J booster jabs for healthcare workers is anticipated to start being rolled out in November. For more now, I'm joined by the Department of Health's Acting Chief Director, Dr. Lesley Bamford. Dr. Bamford, thank you so much for joining us this evening. Now, obviously, we're all keeping abreast of what's happening around the world as this pandemic has rolled out, and also about how countries have reacted to it, and very quickly in many situations. We heard about the booster shot going out to healthcare workers abroad, and now that time has arrived with us. Explain to us exactly how this booster shot is going to roll out, and how does that fit in?
So, good evening, and good evening to the viewers. So, I think, as you will remember, between mid-February and mid-May this year, healthcare workers were offered a dose of the Johnson & Johnson vaccine through the Sisonke study, also known as the Sisonke Early Access Program. And approximately 500,000 of healthcare workers in South Africa were vaccinated through that program. Now, we know that that vaccine provided good protection for 6 to 8 months at least. There is no conclusive evidence that boosters are needed, but there are indications that immunity provided through the Sisonke study is now waning. So although we are not committing to boosters for the general population, the Sisonke study will be extended, or a new Sisonke study is being launched, which will be known as Sisonke 2, or the Sisonke booster study. And as you correctly said, all healthcare workers who received a Johnson & Johnson vaccine as part of the Sisonke study will be offered a booster dose of the Johnson & Johnson vaccine.
You said in the first part of your answer that it was noticed, I might be paraphrasing now, that the protection against COVID-19 of those who received that first shot is waning. What do you mean by that? How can you notice if their protection against COVID-19 is waning as a result of that first jab?
Well, there are indications both from laboratory studies where we see that antibody levels are falling, as well as some suggestions that on a clinical level, the protection that has been provided to healthcare workers, they remain protected, but that level of protection may be falling.
Has this been communicated to these healthcare workers? Is there a warning perhaps that they need to still make sure that they are practicing all the protocols, as we've all, of course, become so used to by now?
So we would certainly hope so. We would hope that our healthcare workers are particularly aware of the need to follow all non-pharmaceutical interventions and to protect themselves at all times, both when they are at work and, of course, outside of the workplace.
Now, obviously, the first part of the Sisonke study was key in preparing the rest of the nation to receive their jabs. Is the understanding then that depending on how this second phase goes, that those who received the J&J vaccine, part of the general population, would also then eventually have get the invite to receive a booster shot, or won't that be necessary?
So I think we must make it very clear that currently the main focus of the vaccine rollout remains our top priority is to reach all adults in South Africa, and particularly the most vulnerable adults, who, as you all know, are older persons 50 years and older, and particularly those who are 60 years and older. So that very much remains our top priority. We have not taken a decision to provide boosters to the general population, whilst we still focus on increasing our population amongst the general population. That said, clearly one of the intentions of the Sisonke study, the Sisonke 2, is to understand in more detail what effect giving a booster dose, in this case to healthcare workers, what effect that has, but with a view to understanding that better and possibly in the future looking at providing boosters to additional segments of the population.
Now, Dr. Bamford, you are, of course, speaking to us in your capacity as the Acting Chief Director of the National Department of Health, but you're also a specialist in child, youth and school health as well. And this is a sector of our, very important sector of our population that really has been in the spotlight in the last couple of weeks as the vaccination process has opened up to that cohort of those 12 and older. In your opinion, how is that process going? Is there enough, are you happy with the uptake in the invite for the youngsters in our population to get vaccinated?
So we are very happy with how the program has started off. It's been running for just over a week now. So as I was saying, really our top priority remains vaccinating adults and the older adults in particular. But we did think it was the right time to open up vaccination to our adolescents. So it's been a relatively slow start, but that is what we had anticipated. There have been no problems. Introduction has gone smoothly, and we look forward to welcoming more adolescents to our vaccination sites. Also, once the school holidays come, once exams are finished and our adolescents are no longer at school and are able to visit our vaccination sites.
Okay, thank you so much for that. That's Department of Health's Acting Chief Director, Dr. Lesley Bamford. Thank you so much for your time this evening.